So I was down in the chicken coop. It was maybe noon, and I was down there spreading some corn around and cleaning up a few things, and all of a sudden, this pressure started in my jaw. So I sat down on a log out in the chicken coop and just sat there for a while, and then it went away. Maybe 10 minutes later, it went away. And I went to the post office, and as I pulled in, that same really hard pressure started in my clavicle, in my shoulder, really hard. So I sat there for a few minutes, and then that went away. So I went on into the post office and picked up the mail, got back in the car and drove a couple miles, and then the pain started in my shoulder. Really, really intense pressure. So I pulled over to the curb and I thought, something bad is happening. I'll either get a hold of my husband or I'm calling 911. So I called him, and luckily he was just a few miles ahead of me. So he turned around and came back to see what was going on. He said, "We're going to the hospital." So he drove me to the hospital, and they let you right in when you're having heart problems. I had two arteries, main arteries, 98% blocked, and a third one that was somewhat blocked. And it took several hours, and my husband was getting pretty worried. But the doctor came back and told him everything went very well. Everything looked good for the prognosis, and I would be in the recovery room. Dr. Williams was the main doctor who came to see me each day then. And then one morning, Dr. Williams came in and said that he wanted me on this cardio rehab program. Exercise was very, very important for a heart patient. And by golly, 2 weeks later, I walked into the rehab center. They taught us about different things about nutrition, about the symptoms for a heart attack, about the medication we were taking, why we take this and why we take that. And I got on that treadmill, and it was real slow at first. Worked my way up to faster, and the incline faster and faster. So we learned a lot, we did a lot. I had 36 sessions, and I graduated. So now I'm on my own. I go to the gym, and I have a treadmill at my home because I want to stay healthy. I really enjoyed the care, the concern that I received from the nurses in the hospital. I felt safe there. And then when it was cardio rehab time, I really appreciated the attendants in there because it was pretty scary for me when I first started. But they were so attentive and fun. I had several follow-up visits with Dr. Williams here at Kootenai Health. And then when I went in December, he had an echocardiogram done on me and gave me the good news that my heart was completely healed. No damage whatsoever to my heart.